In this video, we're going to be reviewing Depakote or valproic acid. The therapeutic class for this medication is an anticonvulsant. The pharmacologic class is carboxylic acid derivatives. It is available in injectable forms, capsules, tablets, and syrups. Indications for use include seizures, mania, migraines, mood stabilizer. It's used with aggressive dementia patients, for psychosis, and for personality disorders. It has been around for about 40 years. The mechanism of action is unclear. It is thought to produce anti-epileptic activity by increasing GABA effects, by decreasing electrical activity in the brain. This medication does have therapeutic levels that are monitored periodically. We want them to remain between 50 and 125. There is also a baseline and ongoing liver function test obtained when the patients are taking Depakote. This includes ammonia levels and platelet counts and bleeding times. Safety and effectiveness of Depakote extended release in children younger than 10 has not been established. But if Depakote is used in a child younger than 10, extreme caution is used, but it does happen. The normal side effects of Depakote include ataxia, drowsiness, weakness, fatigue, menstrual changes, nausea, vomiting, weight gain, and hair loss. The most life-threatening adverse effects are pancreatitis and hepatic failure. There are other significant side effects including thrombocytopenia, bruising, and hemorrhage. There is also a central nervous system side effects that include sedation, tremor, emotional upset, weakness, suicidal ideation, as well as brain atrophy. This medication does come with black box warnings. There are several. The first one talks about Depakote causes life-threatening pancreatitis. It has been reported in children and adults receiving valproate shortly after the initial use, as well as after several years of use. And again, the development of this condition is life-threatening. Depakote is also associated with a rare but serious reaction known as DRESS syndrome, which may be fatal. DRESS syndrome is the presence of 3 or more symptoms, including cutaneous reactions. This can include rash, exfoliative dermatitis, eosinophilia, fever, lymphadenopathy, and 1 or more systemic complications such as hepatitis, nephritis, pneumonitis, myocarditis, and pericarditis. If there is any thought that DRESS syndrome is suspected, the drug will be discontinued immediately. As far as pregnancy and Depakote, there are a multitude of black box warnings. I'm just going to read them to you. I think I have 4 here. Number 1, it says avoid use in patients who may become pregnant. Valproate can cause teratogenic effects such as neural tube defects and other organ system malformations. The drug is contraindicated for prevention of migraines during pregnancy, and women of childbearing age should not take 2 forms of birth control. The second black box warning is that children born to mothers who took this drug during pregnancy have an increased risk of lower cognitive test scores. Other alternative medications should be considered. The third one is use of this drug during pregnancy in women with epilepsy or bipolar should only use if other drugs have failed to control the symptoms. Again, this drug is contraindicated for use in pregnancy for reversible conditions not associated with permanent injury or death. There's another black box warning. It talks about fatal hepatotoxicity. It may follow non-specific signs and symptoms such as malaise, fever, anorexia, facial edema, vomiting, weakness, and lethargy. If these signs and symptoms occur during therapy, the prescriber should be notified immediately and the medication should be stopped. Let's see. Then it talks about other alerts. We should closely monitor all patients starting anti-epileptic drugs for changes in their behavior. And this could include worsening of suicidal thoughts or behavior or depression. Symptoms such as anxiety, agitation, hostility, mania, hypomania may be precursors to emerging suicidality. Another alert for this medication talks about dose-related thrombocytopenia occurring. We need to ensure that there is a CBC, platelet count, and a PT-INR drawn before starting Depakote and at frequent intervals while they're getting the medication. Let's see. As far as patient teaching, this is the last section. We do want to educate the client and their caregivers that this drug can increase risk of suicidal thoughts and behavior, and these should be reported immediately. We need to warn them about stopping the medication abruptly. That is not wanted. They need to consult with their doctor if they decide they do want to come off of this drug. We need to educate them to report immediately any type of rash with or without blisters, fever, swollen lymph nodes, mouth ulcers, or skin shedding. Again, that goes with that Stevens-Johnson syndrome that we talked about in an earlier video. We also need to educate them on abdominal pain, nausea, vomiting, and anorexia can be symptoms of the pancreatitis, and they need prompt medical attention if they start developing any of those signs and symptoms. Clients need to be advised to avoid driving or other potentially hazardous activities that require mental alertness until the effects of this medication are known. We need to educate them about taking this drug at regular intervals and not skipping doses. We need to educate them on keeping their appointments for their blood levels. Females of childbearing age, we need to educate them on birth control. We need to educate them if they are diabetic that this medication may interfere with ketones. So it is important for strict blood glucose monitoring if they are on Depakote. And that concludes our Depakote lecture. If you have any questions, please feel free to ask.